tell me, firstly, we've had the meeting this morning of the Health Board, patient travel's been the item of discussion. What's been decided at the meeting this morning?
Okay, so today we looked at potentially three options. One was to do nothing around patient travel. One was to try and save some money by changing the way in which we support escorts travelling with patients. And the third option was to default to the boat as the preferred method of travel for the majority of our patients. It's fair to say it was a challenging conversation and discussion, but the board have now agreed to approve that option, which is that in future the default mode of travel will be by boat. That doesn't mean all patients are going by boat. We will be working with clinicians to identify criteria for folk where clearly travelling by boat is absolutely unsuitable. And in those cases, patients will continue to be flown to Aberdeen. We will also be working very, very closely with the service providers themselves to try and seek to reduce the rate that we have to pay for travel in any event. But more importantly, we'll be working very, very hard to reduce the number of people who actually have to travel at all. So we'll be working with colleagues in Grampian and here to redesign the pathways that patients go on. So we don't want to be sending people off island by boat for a 10-minute routine appointment in Aberdeen. We only want to send people where it's absolutely clinically necessary, and we want to do that in a way that's appropriate to them. The other thing the board agreed to today is that effectively we will use the fare for travelling on the boat with or without an escort as the default fare rate that we are prepared to subsidise. So if patients wish, they can choose to make their own travel arrangements and fly, and we'll reimburse them up to the cost of the boat, which will include a cabin. So there will be a reasonable amount of reimbursement if patients opt to book their own fares.
And we were saying this morning as well in the meeting that as it stands at the moment, then ADS would still apply to people who were booking flights as part of that, wouldn't it?
The advice we've been given, we've had conversations with ZTrans, who are the local strategic transport partnership. We can see no reason at this point in time why a person booking their own flight to Aberdeen shouldn't be able to book both a low-cost ticket and apply for ADS. Clearly, government may choose to review that at some stage in the future, but as things stand, it would appear as if folk can take advantage of the ADS. We're not advocating that people fly. We, as I say, what we've done today, I think, is defined what would be a reasonable cost for travel. As a board, we have to save money. We are looking to try and save almost £2 million, for which we have no clear plans. This potentially will save £1 million of that. So it's a very, very significant step on the way towards the board being financially sustainable going forward. And it's with that, I think, as the backdrop that we've reluctantly agreed to do this. So we're not doing it because we think it's the best thing to do. We think it is the only way we can make significant savings for the board at this point in time.